Did you know that 1 in 7 women report suffering from chronic pelvic pain in the United States? And that more than 50% of cases involving pelvic pain go undiagnosed? Fortunately, Catholic Health has just launched the Pelvic Health and Rehabilitation Program, featuring multiple specialists to help you and your loved one. We'll learn more about that on Stronger Together with Dr. Dave. Hello and welcome to Catholic Health Stronger Together with Dr. Dave. Today we're talking about Catholic Health's Pelvic Health and Rehabilitation Program. Joining me now is the Chief of Urogynecology and Reconstructive Pelvic Surgery at Catholic Health, Dr. Keith Downing. Dr. Downing, welcome to the show.
Thank you for having me.
We're going to talk about something called pelvic floor disorder today. And frankly, I don't think most people even understand what that means. Just for the audience and for myself, what is pelvic floor disorder, and what are some typical issues or problems that would be categorized under pelvic floor disorder?
Yeah. So when we're talking about pelvic floor disorders, we're talking about conditions, things like urinary incontinence, fecal incontinence, and pelvic organ prolapse. And we think about, say, for example, urinary incontinence. We're thinking about something like stress incontinence, patients who will leak urine, say, with coughing, laughing, sneezing, or with exercise. We also know we see a lot of patients who have urinary incontinence related to having an overactive bladder. So these are patients who experience urgency of urination, the feeling to go, and they can't really wait. They have to hurry to the bathroom, or they might have a leakage accident, or frequency of urination. So they're in and out of the bathroom a lot. These are the patients who, when they go about their day, they know like where every bathroom is, around town when they go out.
Mm-hmm. So this is really interesting because you're saying things that I think most people watching the show, either they've experienced, females have experienced, or they know somebody, whether it be a loved one or a friend, who is dealing with these issues. So these are quite common issues. Very
common issues. We look at the literature. Adult women, a quarter to a third of adult women would have at least one pelvic floor disorder. We look at the risk of ever undergoing a surgical procedure for pelvic floor disorder. That can be as high as 20% by the time a woman gets to the age of 80. So these are conditions that are incredibly common, although as we know they're very common. We say they're common but not normal.
Right.
And we think that's an important note to make so that patients recognize, there is care that can be received, there are treatment options available to them to improve their symptoms, resolve their symptoms.
So you started this amazing program, very interesting, to help address what you just discussed. Tell me a little bit about the program.
Yeah, so the Pelvic Health and Rehabilitation Program at Catholic Health was really put together in recognition that pelvic health issues can be very sensitive issues for patients, and things that they don't always talk about or share with family members, or sometimes even with their physicians. And so we wanted to create a resource that patients could access to seek the care or access the care that they would benefit from. I think our clinical and administrative leadership in the Women's Health Service line kind of recognized that this was an opportunity to really serve our patients in a better way. And in doing that, we recognize that when we think about the pelvic floor, the pelvis, there are multiple organs present, and so it often requires a multidisciplinary approach. It's not just the urogynecologist; it may be the urogynecologist, the colorectal surgeon, the pelvic floor physical therapist, maybe the gynecologic, invasive gynecologic surgeon, so the gastroenterologist. So it's definitely requires a multidisciplinary team, and so that was the idea behind the center.
So this really is a one-stop center to help address this problem. This is a place that somebody who is suffering from these issues can call and feel confident that they're in the right place, that they're not going to have to go anywhere else, that you can handle basically anything that they need, whether it be medicine, surgery, or physical therapy.
That's the idea.
Right.
Patients access the center, and through our nurse Navigator, will get to the right care. And one of the things we certainly also know about pelvic floor disorders is we talked about women having one or more, right? So it's not uncommon that someone may have, say, pelvic organ prolapse and they are suffering from urinary incontinence, or they have a fecal incontinence issue. When we think about the pelvic pain side of things, pelvic pain can have a range of etiologies, some related to the gastrointestinal tract, some related to the reproductive tract, some related to the urologic system. So the idea is that when patients, kind of access the center, we can evaluate them, understand what their symptoms are, and get them to the right individual or individuals in a timely way. And when we're talking about, providing multidisciplinary care, allowing us to collaborate and coordinate that care more easily.
So why don't we hear more about these pelvic floor symptoms of incontinence or even pain? Do you think it's some stigma? Do you think women as they age feel that it's menstrual pain or menopausal pain and it's just part of normal aging?
Yeah.
What is your feeling?
I think there's definitely still some stigma to this. I mean, these are still issues that patients don't, this is not necessarily the conversation at the cocktail party, and family gatherings, and
Right.
sometimes, mothers and daughters aren't always sharing about these issues. I think that's changing somewhat. Some of our national organizations have done a lot of work trying to spread the word around pelvic pain and pelvic floor disorders, trying to increase the awareness in the general population. But these are still issues that patients, as we said earlier, don't necessarily share amongst themselves with friends or family, don't always come forward to their primary care physician and talk about these issues. So I think the more we spread the word, the more we normalize these issues. We think about some of the risk factors or the life exposures that lead to pelvic floor symptoms. You're talking about, pregnancy and childbirth, right? You're talking about going through menopause. You're talking about aging, right? So living life, in a sense, right? So these are very common conditions that affect a whole host of women.
What's normal and what's not normal? And when should they actually reach out to the center to get some help?
Yeah, I think if you're having any of these sorts of symptoms, you reach out right away. The sooner you reach out, the better. There's no, a little bit of incontinence is okay. It may be manageable,
Right.
but it doesn't necessarily mean it's okay. And I think the sooner we get patients to care, the sooner we can help resolve their symptoms or improve their symptoms. And we mentioned earlier about pelvic floor physical therapy playing a role. That's something that's very much, many people would say, underutilized in our communities kind of across the U.S. And that's something that, particularly when symptoms are less impactful in terms of a patient's day-to-day life, that's a great place to start for patients to gain a greater understanding of their body, this part of their body, and begin an intervention that can lead to significant symptom relief.
Amazing. So it's not just surgery. You would start with something like physical therapy, maybe some medical intervention or hormone replacement, and then eventually possibly surgery.
Absolutely.
Right.
We talked about, there's some medical therapies depending on the condition we're specifically talking about, and surgical interventions that we use to treat things like stress urinary incontinence and pelvic organ prolapse and some pelvic pain conditions like endometriosis. But there are a range of options, and I think making that decision really comes down to a patient-centered approach where you're trying to gain a full understanding of that patient's symptoms, what may have been done in the past for that patient, either medically or surgically, where they are now, and then talking through what you think the next best step will be for them in their care.
There are solutions that are not surgical, whether it be physical therapy or medical. Tell us a little bit more about that.
Yeah, I mean, weekly I'm having a conversation with patients about the management of issues like overactive bladder, how we're managing their recurrent UTIs, issues around vaginal dryness. And often having conversations about, well, what are some of the dietary changes that one can make that can help with issues around specifically urge incontinence? Things like avoiding caffeinated beverages with artificial sweeteners or preservatives in them, carbonation, alcohol and tobacco, caffeine kind of being the one that looms larger over the others. We often talk about using vaginal estrogen cream in patients to relieve dryness, but also we know that can also have a benefit in terms of improving urinary urgency or decreasing the risk of recurrent urinary tract infection. And so that's also something we use often in patients who are appropriate candidates for vaginal estrogen cream. Pelvic floor muscle exercises. So Kegel exercises or Kegel exercises. And so that's something we often are counseling patients about. Every patient I examine in the office, I assess their ability to do or perform a Kegel.
So a Kegel, just for the people watching, Kegel exercise, not without getting into too much detail, but it's basically an exercise that people are, they're training or working their pelvic muscles? How does it?
Exactly. You're squeezing your pelvic floor muscles, the muscles that you'd use to hold in gas or urine. And so we know when you can strengthen those muscles, it can help you avoid leaking accidents, urinary incontinence accidents. It can help quiet urinary urgency. One of the things, patients often think they're doing Kegels, but they're not always doing it correctly.
Right.
And that's why we're very intentional assessing that in the office. And that's also where things like pelvic floor physical therapy can become very helpful, because patients who don't have a great connection between the brain and those muscles in their body, they can work with a therapist and kind of have hands-on support to achieve that ability.
Right, and again, the message is, you may have these symptoms. It's not necessarily part of aging, and you don't have to live with it. You don't have to suffer with them. There's a lot of treatments. Absolutely,
and I think a lot of patients do think, well, this is just a normal part of aging, and so they do kind of live with it. But I think the word we want to spread is that yes, common, but not normal. And there are a range of treatments, minimally invasive, non-surgical, medical and surgical treatments when appropriate that can help relieve these symptoms.
Right, and I think also with social media, people are being more proactive and they are seeking advice. And that also concerns me though, because they're gonna get some maybe not such great medical advice. So that's why it's so important to really go to a center such as yours, where you have top experts who really are practicing evidence-informed medicine.
Absolutely, and I certainly don't want to discourage patients from seeking information out in public forums and on social media, because there's a lot of good information out there, but I think you want to take that and bring it to a specialist, and you can compare and contrast, and I think, as you said, kind of really get evidence-based insight into therapies or options you may have seen online.
Dr. Downey, thank you for coming onto the show today. It was very informative, and we're definitely going to have you come back.
Thank you for having me.
Coming up next, we'll learn more about the different specialties involved in the program and meet the nurse practitioner who will help to guide you each step of the way. You're watching Stronger Together with Dr. Dave.
When you come to Catholic Health Cancer Institute, we'll get to know you. Every detail, from the genetic makeup of your cancer to your other health conditions to your emotional and physical needs. Because each detail gives us another opportunity to personalize your care and improve your outcome. And all of them can add up to a life-changing difference. At Catholic Health, we know you, we know cancer, and we know your cancer.
Knight's being a family-oriented organization and also a community organization. Anything we can do to better the lives of those in need, it's an opportunity to really put your faith into action.
I'm very grateful for them. I appreciate them so much. They are always here. It's like a family.
Hi, I'm Susan Lucci. I never thought about heart disease until I had my own heart event. I had heard many times that heart disease is the #1 killer. It went in one ear and out the other, frankly. I never had a health issue, but suddenly I had that pressure, that elephant pressing on my chest. By the time I got to the ER, the doctor decided to give me a CAT scan. I had a 90% blockage in my main artery and a 75% blockage in the adjacent artery. I received 2 stents in my arteries. Stents developed through research funded by the American Heart Association. That's why I'm in front of you today. I'm so grateful to the American Heart Association. Their research helped save my life. Put yourself on your to-do list. It could be the most important thing you ever do. Learn more about the American Heart Association's life-saving work at helpheart.org.
Welcome back to Catholic Health, Stronger Together with Dr. Dave. Today we're talking about Catholic Health's Pelvic Health and Rehabilitation Program. This sounds like an incredible program, and it's about to get even better. In addition to the excellent clinical care, the program also offers one-on-one patient navigation with a nurse practitioner to coordinate all of your pelvic health care needs. Joining me now is Larkin. Lauren, welcome to the show.
Thank you, Dr. Dave.
So this is really interesting. You are the nurse navigator for the Pelvic Health and Rehabilitation Program.
Yes, I am.
In plain English, what does that mean?
So in plain English, women have had long-standing issues for years that have kind of been swept aside because they're embarrassing or people thought it was a normal part of aging. So with our pelvic health program, we're trying to capture those women who have issues, and we want to give them proper treatment. So with pelvic health, we have patients who may have any type of disorder like pelvic pain. They may have an overactive bladder, incontinence, prolapse, endometriosis, all sorts of things.
Somebody who's having these symptoms, they'll reach out to your program and just walk us through the steps on how, from walking through the door until they have a program, a treatment program designed for them. Tell us about that.
So I am a nurse practitioner, and patients can self-refer to me. They can get the number for the Pelvic Health Center. It's online.
So they can reach out to you. They should not be waiting for their doctor to refer them. If they're having symptoms, they now have a place, confidential, that they can reach out and start the process.
Correct. So patients can always reach out to me, and they'll leave a message for me. I'll get back to them. I'll do a telephone interview with them to try and triage them ahead of time and figure out what their issue is. If they don't have a provider who has referred them, they'll come to see me first. I will then determine what their issue is, and from there, I will act as their tour guide. And I will walk them through the process to which other specialists they need to see.
That's fantastic. That is so important because I think, my own personal opinion is people are overwhelmed. If they have a symptom, I think the hardest question for patients to answer is, who do I speak with? Where do I go? So now they actually have somebody, like you said, and I love the way you phrased it, a tour guide, right? So they can reach out to you and you can shepherd them to the right place to get the treatment they need, if they need any treatment.
Yes, absolutely. And I feel that a lot of women do find this embarrassing, so they don't know who to talk to about. They can call me, and I can give them that women's perspective and keep their dignity when they're dealing with these sometimes embarrassing issues.
So women don't have to live with these symptoms that they've probably been living with for a long time.
Correct.
Right.
They need to know that these symptoms are real and they are not normal, and there are treatments out there.
In terms of success, let's say overactive bladder, for example. In terms of, in your opinion, your experience, what is the percentage of patients who you actually are able to help and improve their symptoms? What's your best guess?
I would say in my practice, I've seen 80 to 90% of patients who are quite happy with their treatment. There's different treatments that we can do for them. There's pelvic floor physical therapy, there's medications, there's all different types of things that we can try. So even if they've had this problem and they've tried one medication before, but they're not happy with it, don't stop there. Come back to us, see us, and we can work together to make this issue resolve.
What are people overlooking in terms of how they can help themselves with, let's say, overactive bladder or incontinence?
So people don't realize how much diet does contribute to things like overactive bladder. We can do what we call bladder training programs with people. Sometimes they don't think about going to the bathroom until it's too late. So different ways to modify their lifestyles. There is, with pelvic floor therapy, they can also strengthen some of those core muscles that would help them to not have as many issues.
Is it easier to treat this problem, like most medical problems, when it's early, when it's just mild? Or should people wait until it's moderate to severe? At what stage should they come in?
No, in my opinion, as soon as a woman starts dealing with any of these symptoms, I would come in, give me a call, and we will start treatment. This way, we know that things aren't going to get better once they start. They're only going to progress. So if we can catch them before they get worse, then it's going to be better for all of us.
Right, so even somebody who, if they're laughing loud or straining to pick something up and they have a little incontinence, that's not normal.
Correct, that is
Okay.
not normal.
Okay.
So what would happen with someone like that is most likely I would refer them to the urogynecologist. We have some fabulous urogynecologists within Catholic Health. We're very lucky that way. And then we would probably do some urodynamic testing, which would actually show us the stress incontinence so that we would know how we can treat that patient.
And in terms of the age, are you dealing with mostly postmenopausal women, premenopausal women, perimenopausal women? Like so if a female has, let's say, pelvic pain or discomfort, and she's premenopausal, would you still address that, or would that just be part of, menstruation? When do we know that it's more than just menstrual pain? It's something that they should address.
So if they have had this menstrual pain in the past and they've seen providers, they haven't had any treatment that's helped them, then they definitely should come to us. We treat patients of all ages. We have people from their late teens up into their late 90s.
Anything else you want to add about the program that you might want viewers to know?
So we're located at 500 Comac Road, which seems to be a very good meeting point for everyone, no matter if they're in Suffolk or if they're in Nassau. It's right off the northern state, right off the Saginaw coast, very easy to get to. It's a state-of-the-art building for our women's health program. We have 4 dedicated rooms to women's health. Everything is brand new in there. It is very private. It is very personal. So women don't have to feel like all their business is being broadcasted all over the place. We also have different consultation rooms that if we're not having a regular appointment, we can sit in a private room and talk about that with them.
Hopefully people will reach out, and I'm sure there's a lot of people out there we can help, as soon as possible.
Yes, I encourage everyone, reach out if you have any pelvic health issues. We also do take referrals from other providers. So if you've seen someone, if you've heard about our program, you can ask them about it. They can put a referral in the computer system for me. They can call me. I will get back to them and we'll walk this path together.
This is great. I'm so happy you joined us today, and we'll definitely have to have you back on the show and get an update.
Thank you so much, Dr. Dave.
Thank you. Coming up next, we'll hear from one of the specialists Lauren mentioned and how they'll keep you on your pelvic health healing journey. You're watching Stronger Together with Dr. Dave.
As you go about your daily life, look closer. As you gather with family and friends who love and support you, look closer. There are youth right in your community who don't have the home, warmth, and healing you have. So look closer. Every year across America, a staggering 4.2 million youth are homeless or trafficked. And for 50 years, Covenant House has worked relentlessly to keep them safe and protected. Tonight, 2,000 young people will sleep safely in a Covenant House bed. And tomorrow, they will wake up surrounded by love. They get clean clothes, hot meals, medical care, and a safe place to sleep. 24 hours a day, 7 days a week, in sites across America to help them fulfill the great promise of their lives. So look closer at Covenant House. To help or get help, go to covenanthouse.org.
At St. Francis Heart Center, we're not just regional heart experts. We share our greater success with the world. We don't just pioneer technology. We do it more than anywhere on Greater Long Island. And we don't just win awards. We deliver greater outcomes for people like you. As New York's only specialty designated cardiac center, we're not satisfied with just being good. This is Long Island. This is St. Francis Heart Center. And greater lives here.
Kids across America are going to school hungry. Millions of kids every day. But one simple thing can help change all of this for a hungry child in America. Good, healthy food and the energy it brings. With help from caring people across America, No Kid Hungry is providing healthy meals and hope to hungry kids so they can build better futures. To learn more about ending child hunger in America, Go to helpnokidhungry.org today.
As farmers and ranchers, stewardship of the land comes naturally. You help keep water clean, improve the soil, and provide habitat for wildlife. But did you know that conservation can also improve your bottom line? Learn more at conservationpays.org.
Welcome back to Catholic Health, Stronger Together with Dr. Dave. We just learned about the new pelvic health program available at Catholic Health and the step-by-step process for new patients who enroll in the program. Now, let's meet one of the specialists who will be helping you or your loved one.
I treat a variety of conditions, but the most common conditions I treat are endometriosis, pelvic pain, fibroid uterus, and abnormal uterine bleeding. Conditions such as chronic pelvic pain are difficult conditions because it often involves physical, emotional, social, and existential factors that are individualized to the patient. Because of this, it's really difficult for one provider to take care of the patient. Oftentimes, patients require a team to take care of them. So at Catholic Health, we have a full team of specialists, including OBGYNs, minimally invasive gynecologic surgeons, urologists, urogynecologists, mental health professionals, physical therapists, colorectal surgeons, and much more that can potentially be on that patient's team. When you have a team, it offers a more comprehensive, individualized and sustainable treatment plan to treat both the causes and the symptoms of the condition. At Catholic Health, we offer the latest surgical techniques. This could include hysteroscopic surgery, vaginal surgery, laparoscopic surgery, and robotic surgery. Whenever possible, your surgeon is always going to choose the most minimally invasive route, whether that's an incision through the vagina or small incisions through the abdomen for laparoscopic or robotic surgery. Every time that we encounter a patient, we are always considering the patient factors and will offer the best route for the patient. Hysteroscopic surgery is when we put a camera inside the uterus to take a look around and see if there's any abnormalities. We usually do this for conditions such as abnormal uterine bleeding, endometrial polyps, and submucosal fibroids. Vaginal surgery is surgery that's performed through the vagina. We often do this for vaginal repairs, prolapse surgery, and possibly a hysterectomy. Laparoscopic and robotic surgery is a minimally invasive surgical technique that allows us to treat complex gynecologic conditions such as endometriosis, fibroid uterus, and ovarian cysts through small incisions in the abdomen. Compared to the traditional open or large incision approach, minimally invasive techniques offer a shorter hospital stay. Oftentimes patients go home the same day. It's a quicker recovery time. Patients are oftentimes able to go back to work sooner and return to normal activities sooner. There's less risk of bleeding during the operation. There's less risk of infection. There's minimal scarring and less pain during the recovery process.
Thank you to all of our guests today for sharing more about Catholic Health's Pelvic Health and Rehabilitation Program. If you would like to know more about Catholic Health or to make a gift in support of one of the amazing programs you heard about today, please visit CatholicHealthLI.org or call 1-855-CHS-4500. Thank you for watching today. I am Dr. Dave Degatti, and I'll see you next time on Catholic Health, Stronger Together with Dr. Dave.